This is Eric Friedlander, Secretary of the Cabinet for Health and Family Services. I'm here today to talk a little bit about long-term care. Long-term care facilities in Kentucky, and that includes assisted living and other congregate care facilities, is a challenge. With COVID-19, we've seen across the nation and across the state that this is probably our biggest challenge. And we at the Cabinet for Health and Family Services take that very seriously. So what have we done? In the beginning, the governor ordered the end of visitors to these facilities to stop the spread of the virus. Unfortunately, the virus is tricky and it gets into facilities, and we've seen that both within our state facilities like Western State Hospital and Hazelwood, but also in the private facilities across the Commonwealth. When someone goes in or when there's a positive test in a facility, our hospital infection team is on the phone immediately from public health, and the local health department is on the phone, and Dr. Stack is on the phone, and the Inspector General, Adam Mather's on the phone, and a myriad of others to try to work with the facilities and have worked with the facilities to come up with plans, sometimes to just be an ear, to help these facilities deal with the aftermath and the impact of positive COVID tests in facilities. After we do that, and in the beginning, we didn't have enough personal protective equipment. We didn't have enough testing capacity. That is absolutely true. But now we're starting to have more. The federal government just this week is providing more personal protective equipment to our long-term care facilities. Those that go through the web EOC application and tell us about their own personal protective equipment supplies and their what's called their burn rate, how quickly they're using it, we've been supplying much of that personal protective equipment to many facilities across the Commonwealth. There's something in the Inspector General's office called the Civil Monetary Penalty Fund. These are when facilities get fined, and we've opened that up for facilities to work on some of the technology pieces, the iPads, better ways for those families who can now no longer visit in these nursing facilities to be able to have a virtual visit. We're also now expanding testing. Some facilities have done facility-wide testing. We've done some of that for our state facilities, but we're going to take a much more aggressive stance on facility testing. So we've working with a partner. Norton Healthcare has helped us, and they, along with our hospital acquired infection team, along with the local health departments, along with local hospitals and other partners, have come up and increased our capacity for testing, and that's what we're going to do over the next couple of months. And we're going to try to test every person in every facility so that we can know how to respond. We've seen, unfortunately, a lot of deaths in our long-term care facilities. These are people who are vulnerable. These are our most vulnerable folks, and particularly vulnerable to this virus. It is a tragedy at any time. The other piece then is that when families can't visit, they don't know what's going on. They don't know exactly what's happened. And so that is a concern of everybody in the cabinet. We know we don't have enough eyes on people in facilities, but we're always trying to balance between the threat of this virus, how much we survey, how many eyes get in facilities, because every additional person in a facility is somebody that, if they're asymptomatic, has the chance to be bringing that virus into a facility and introduce it into a most vulnerable population. So I want you to know we are working very hard. We've put guidance up. We've had a task force of group of folks who are medical directors of facilities, the University of Louisville and University of Kentucky. Our team, we've been working together to come up with some of those guidelines, to come up with some of the plans to help facilities. We are trying to do as much as we can to support these facilities as possible. We've changed some of our eligibility guidelines. We've changed some bed hold days. We've got an additional reimbursement piece for long-term care facilities, and we'll continue to work with them and work with their associations to come up with as good of a plan as we can in what is probably one of the most challenging times facing long-term care facilities in Kentucky and facing Kentucky in general. So we'll continue to work, we'll continue to learn, we'll continue to collaborate, because in the end, what the governor always says is, we'll get through this and we'll get through this together. And what I like to say is, and it's the only way we're going to get through this, is if we get through this together. Thank you.